It's a pleasure to join you, although not live in Parma, but to join you from Amsterdam. So what we will do in the setting of the NPATH program is a hands-on training in diagnostic nephropathology, which I will tell you something about. So if you take a look at the website of the NPATH program, you will find this motto: New paradigms of learning and knowledge sharing. And that's exactly what we intend to do with our part in this great consortium. And we are really looking forward to that. We will participate in the REMAP program, so that's the renal molecular pathologists. We specially designed a 3-day hands-on course in diagnostic nephropathology for nephrologists in training. So in principle, all the trainees will come for 3 days to Amsterdam to study nephropathology. And our goal that we have in mind is to share in-depth knowledge of nephropathology with all these nephrologists of the future. And we think that that is really vital for high quality nephrology care in Europe and all over the world, because when nephrologists and pathologists are able to speak the same language and are able to discuss histology patterns they see through the microscope or on the screen, this will eventually improve patient care. So we will do this from Amsterdam. The Amsterdam UMC is now the largest university hospital in the Netherlands. We are affiliated with 2 universities, so there's a very rich academic climate, I should say. And because of that, I think the Amsterdam UMC always ranks among the top 50 medical schools in the world in several of these famous lists you always see. How about the Department of Pathology, where we will host the students? We are a large department with 300 persons working here. And among the 30 pathologists, there are 3 dedicated nephropathologists. And we process more than 600 kidney biopsies per year, which is quite a lot because we are a small country. And these biopsies come from all over the Netherlands, but also from abroad, such as the Dutch Caribbean. So, well, I already told you this. So we designed a course in diagnostic nephropathology for our trainees. So the Department of Pathology processes more than 600 biopsies per year. And these are not only primary renal diseases, but also transplant cases, pediatric nephrology cases, and consult cases. And we routinely apply electron microscopy to all of these biopsies. And of interest, all our slides are now scanned for digital pathology purposes, which is great for especially teaching and all other kinds of applications. So these are the 3 dedicated nephropathologists that will welcome the students in Amsterdam and that have designed the course. Professor Sandrine Florquin, who is the chief of renal pathology in our center and who could unfortunately not join us this morning. Then to the right, we have Dr. Jesper Kers, also dedicated nephropathology and an expert in digital pathology, artificial intelligence, and all kinds of machine learning techniques to study kidney biopsies. So that's really an innovative twist that he is giving to patient care in our department and to our research, and also to the course that we have designed. And myself, I'm the one in the middle. We teach a lot, so we think it's really important to teach clinicians, especially nephrologists in training, the basic principles of nephropathology, and that's exactly what we intend to do in the REMAP part of the NPATH program. So every year we organize a European renal pathology course. We are ambassadors for nephropathology of the ISN, of course members of the REMAP consortium, an important teaching tool. And apart from that, we have always a lot of fellows who study nephropathology in our department every year. So what will the students learn when they come to Amsterdam? Of course, they will learn the general principles of nephropathology. We will have some instruction on how to handle a kidney biopsy, which special stains are there, including light microscopy, the immunofluorescence technique, which is so vital for diagnostics, and also electron microscopy. And we will cover the entire spectrum of glomerular diseases, both the common ones, think of membranous glomerulopathy, but also the rare ones, think of Alport's disease or immunotectoid glomerulonephritis, just to name a few. We will cover tubulointerstitial disease, and there will be an introduction in transplant pathology and in machine learning approaches. And this will not only be lectures, because it's a hands-on training, so the lectures are interspersed with fully digital hands-on slide sessions. And maybe it's interesting if I quickly show you what this looks like. So I switch to my other screen. I think you can see it. So this is just one of the cases of a few hundred we have digitized and which are available for the students. A case of it's a pediatric case. So here we have some clinical data, and then the students can look at the biopsy. So they can zoom in, review all the particular aspects of the renal tissue. So you can see how every student can move through the biopsy. And in this case, we see a glomerulus with some inflammatory changes. Then we have the immunofluorescence stainings that go with it. And then finally, we also have some of the electron microscopy pictures, as you can see over here. And after the 3-day course, the students will immediately recognize that this is a case of dense deposit disease. So that's just to give you an impression of how the system works that the students will work with. So that was all. It will be a pleasure to welcome all the nephrologists in training in Amsterdam, if COVID measures allow. So we're now discussing this with our authorities, if it's possible to have this large group in Amsterdam. I hope so, because it will really be worthwhile. So that's my final slide. So thank you very much for your attention. And